Okay, let's unpack this. Today, we're doing a deep dive into some specific clinical revision notes, focusing on a condition called black hairy tongue. Sounds a bit dramatic, doesn't it?
It really does.
Yeah.
And yeah, our plan here is basically to take those notes you've got and just pull out the really key high-yield stuff, the absolute must-knows for revision.
Exactly, like a cheat sheet from the source material. And what's kind of fascinating, I think, despite that slightly alarming name, is how benign it actually is. So let's get into what the notes say.
Right.
So, definition first. The source material describes it as, well, a benign condition. It's where the papillae on your tongue get elongated and discolored.
Yeah, those little bumps on the tongue surface. And that discoloration, that's the key part visually. The notes say it looks black or dark brown, sometimes even yellowish brown.
Yeah, yellowish brown too. And it's because of a buildup. Dead skin cells, bacteria, just sort of debris collecting on those overgrown papillae.
Okay, so why does it happen then? What makes those papillae get longer and hold on to that stuff?
Well, the notes mention the exact cause isn't, perfectly clear. But the basic idea is something disrupts the normal shedding process of the tongue's surface cells.
Ah, okay. So that normal turnover gets messed up. And the notes list quite a few risk factors, right? Things that can trigger this disruption.
They do. Poor oral hygiene is a big one, which kind of makes sense with the buildup idea.
Sure.
Also, tobacco use, both smoking and chewing, are mentioned.
Right. And wasn't there something about drinks, too?
Yeah, this surprised me a bit. Even drinking excessive amounts of coffee or tea is listed as a potential risk factor.
Okay. And medications.
Yep. Certain ones, antibiotics get a mention, and also things containing bismuth, plus conditions that might, lead to more bacteria or fungi in the mouth.
Like what sort of conditions?
Things like dry mouth, having had head or neck radiation, HIV, even IV drug use are down as predisposing factors in the notes.
Got it. So the pathophysiology, then, is how these risk factors lead to the look.
Exactly. The notes explain that when the shedding gets interrupted, you get this accumulation of keratinized material, basically protein buildup and bacteria on those longer papillae, and that's what gives it the characteristic, black or hairy appearance.
Makes sense. So clinically, what would you actually see or feel, I suppose?
Well, the main thing is obviously that dark color change, black, dark brown, maybe that yellowish brown we mentioned, and the tongue can look elongated or have a fuzzy sort of hairy texture.
Right. But symptom-wise, do people feel anything?
That's a key point from the notes for revision. Most people actually have no symptoms. They just notice the appearance.
Okay. But some might, potentially.
Yeah, a few might notice maybe a metallic taste or halitosis, bad breath.
And diagnosis, how's that done?
According to these notes, it's primarily clinical, just based on the appearance of the tongue.
So just looking at it usually does the trick.
Pretty much. Biopsy is mentioned, but only sometimes, really just to rule out other things if the picture isn't clear.
Okay, and that brings us to differentials. What else could it potentially be confused with? That seems important.
Definitely. The notes list things like oral candidiasis thrush, basically,
Huh.
oral melanoma, which is obviously way more serious, pigmented fungiform papillae, and certain systemic disorders too. So you need to have those in the back of your mind.
Right, to be able to distinguish them. And how common is this condition?
The notes say prevalence in the UK is actually uncertain. Generally considered rare, but it might vary between different populations.
Okay, so management. If you see this, what do the notes recommend?
The big emphasis is on improving oral hygiene. So actively brushing the tongue or using a tongue scraper to get rid of that buildup.
Makes sense. Keep it clean.
Yeah, and regular dental visits are advised too. And crucially, tackling those underlying risk factors we talked about.
So like stopping smoking, cutting back on the coffee maybe?
Exactly. Or if a medication is suspected, talking to the doctor about potentially adjusting it. Oh, and if there's a fungal infection, like candida, happening at the same time, topical antifungals might be used.
Gotcha. And the prognosis, what's the outlook?
Generally good, actually. It's benign. The notes say it usually improves with better hygiene and addressing the cause. The discoloration tends to resolve.
But it could come back.
It could, yeah. Recurrences are possible if those risk factors aren't kept under control long term. Complications aren't really severe, mostly just the look of it, or maybe that bad breath.
Anything else?
Very rarely, the notes mention if the papillae get really long, they could maybe cause a slight gagging feeling or some mild discomfort, but that seems uncommon.
Okay. So pulling it all together then, black hairy tongue looks dramatic, but it's basically harmless, right?
Pretty much. It's managed mainly by simple hygiene improvements and dealing with those risk factors. The key takeaway from these notes for revision seems to be recognizing it clinically and knowing what else to consider.
Yeah, differentiating it is key. Which leads to maybe a final thought for you listening. Given how striking it looks, and how easily it could be mistaken for something serious if you didn't know, how important is just doing a quick visual check of the tongue in routine examinations?
Definitely something to think about. Right, we hope this deep dive into your notes on black hairy tongue was useful for your revision.
Yeah, hopefully high yield. And for more resources to help you prepare, remember to check out pastomsra.com.
And freemsra.com as well. Join us next time for another deep dive.